Scientists at the National Centers for Disease Control in Atlanta today released the results of a study which shows that the lifestyle of some male homosexuals has triggered an epidemic of a rare form of cancer.
Federal health officials consider it an epidemic, yet you rarely hear a thing about it. At first, it seemed to strike only one segment of the population. Now, Barry Peterson tells us this is no longer the case.
The Center for Disease Control in Atlanta, where 400 cases have been reported, a special task force has now been set up. One possibility, a rare herpes virus may attack the body's immune system, bringing with it the cancer or a lethal form of pneumonia.
June 1981, Brandt says 1,450 persons have contracted AIDS, which leads to a total breakdown of the body's immune system. 558 of those victims have died, and there is no known cure, and every day 4 to 5 new cases are discovered. Up till now, AIDS has affected only homosexual men, intravenous drug abusers, Haitian immigrants, and hemophiliacs. But there is now conflicting scientific evidence that AIDS can be transmitted through blood transfusions, heterosexual relations, or by casual contact among families of AIDS victims.
On hearing that I was HIV positive, I was immediately overwhelmed with images from my childhood, things I remember seeing on TV. According to the TV ads in the 1980s, HIV was a death sentence, and I wondered, was I going to die?
Not since cancer, polio, tuberculosis, or leprosy has a disease caused such widespread fear.
Even today in other countries, if particularly a woman is discovered having AIDS, she is cast out from the family and discarded as being less than human and unworthy of her family's attention and nurturing. And I think it was 20 years ago, we were the same in the United States of America. And there are many of us who look at other countries now and the way they feel about people who get AIDS, and we're like horrified that people could be so insensitive and so prejudiced. But just 20 years ago.
The 1980s were incredibly challenging for HIV medicine. Of course, we were trying to understand the biology of the emerging threat and treat a pandemic, but we were also faced with the stigmas associated with the disease and the irrational prejudice against the populations initially affected.
Commission on AIDS that his classmates and the community made him an outcast.
I became the target of Ryan White jokes, lies about me biting people, spitting on vegetables and cookies in grocery stores, and urinating on bathroom walls. Some restaurants threw away my dishes, and my locker was vandalized inside and folded.
The truth is, anyone can be affected. We've known that since the beginning, but as a society it took years to face that concept. For a time, progress was limited by global misconceptions, insensitivity, and ignorance.
World AIDS Day has provided a means for education on a global scale. Many of the themes for World AIDS Day since 1988 have focused on awareness and education. We need that if getting to zero is to become a reality.
In the 1990s, themes of World AIDS Day focused on children. This drew attention to the event, but also helped alleviate some of the stigma. Ryan White's story was a turning point in the public's understanding of the disease. People realized that anyone could be affected.
I had no idea how far we had come in 30 years. Sure, we've advanced medically. HIV isn't the death sentence it was in the 1980s, and there are many safe and effective treatment options now. And I think our progress goes beyond medicines. It is also seen in towns, schools, communities. The discrimination and ignorance that Ryan White and so many others face continues to erode as everyone becomes educated.
Since I started at Hershey Medical Center, our comprehensive care program has grown to include over 800 patients. Funding from the Ryan White Foundation has helped expand our resources that we can reach more people. We have practice sites in Harrisburg, Carlisle, Lewistown, and Altoona. We can reach far and wide, but in the end, our patients and their communities need to be involved. Events like World AIDS Day encourages that involvement and solidarity.
Opt-in for Life evolved as a theme for our comprehensive care program because it encourages a lifelong commitment to awareness, education, and prevention. Our program is currently using multiple forms of social media, Facebook, Twitter, and Pinterest. Anyone from the community can join, can reach us through these media. Stories can be told, questions answered, misconceptions corrected. Breakthroughs can be discussed. These interactions form the root of solidarity that will get us to zero.
One day I'd love to say, I used to have HIV. If we stay informed, educated, and united, with the help of events like World AIDS Day and resources like Opt-in for Life, that dream that we all share will be a reality.